Guess who's back? Back again. COVID's back. Tell your friends. Also, new boosters available. But can we trust the authorities that are recommending them? Hello there, you 6.5 million awakening wonders. Thanks for joining us on our voyage through truth and freedom. We are coming together while they try to divide us. We demand decentralized democracy while they try to make the world one conglomerate of elitist power. And how do they do it? By justifying authority. If there's a constant wave after a new wave of pandemic, then of course you need to submit to centralized authority, and COVID is back again. We've only just got rid of COVID, it's back. And in other news, new boosters are available. I wonder if there's some connection between these new scary waves of COVID and these new brilliantly effective boosters. Let's have a look.
COVID is making a comeback this summer.
It's not ABBA.
So many of us would like to leave it in the past, but cases are once again on the rise. So when will new booster shots roll out?
The news is literally propaganda. Okay, oh no, COVID is back again. So when will booster shots be available? And why should you do exactly as you're told by the media? And how is this Donald Trump's fault somehow?
Ann Thompson asked the CDC director.
This summer, most Americans left COVID in the past.
The past he's waving to it. Goodbye, COVID. But who's this? It's new COVID.
But tonight, signs of a COVID resurgence.
What's behind this uptick in COVID that we're seeing?
The main driver of this is a variant that's relatively newer to the scene, EG5. It's easier to give and get.
Another catchphrase, it's easier to give and get. New COVID, EG5.
So that makes it kind of easier to pass along.
It's been almost a year since the last COVID booster came out. CDC Director Dr. Mandy Cohen.
The new COVID booster is expected to be approved by the FDA.
Yeah, I'd imagine so. I mean, if I had to put money on it, I would say it will be approved by the FDA.
Will it protect against this new strain?
Yes, the booster is tailored to what we are seeing circulating now.
We've heard this before. Oh yeah, for the last couple of years, all the time. And then what did we subsequently learn?
We likely will see this as an annual COVID shot, just like the flu shot.
Spring break, Halloween, Christmas, Thanksgiving, and of course, lots of Moderna money.
Just in time for fall, when we'll also face RSV.
Can you take the flu shot, the COVID booster, and the RSV vaccine all at once?
Can we get all of these things into one convenient, profitable package? I've not seen this before, but my guess is that Mandy's going to say that we can.
So for flu and COVID, yes. RSV, again, is only available for older adults. That's one where I'd say talk to your doctor about what's right for you.
That's an interesting pivot. It didn't used to be ask your doctor. It used to be we'll tell your doctor what your doctor can say to you. Otherwise, your doctor will be fired. Remember that?
So until the new COVID booster comes, get prepared. Stock up on at-home tests. They do cover that new strain. Keep a mask handy in case you're in a crowded place. And most of all, get your shots. COVID, flu, and RSV, all by Halloween.
That's actual news. That's actual news. That's not an advert. I would accept and respect that council if they were being responsible around the clinical trials, the errors in clinical trials, the vaccine injury stories, the evolution of the understanding around the efficacy and lack thereof around lockdowns, same for masks, same for social distancing, same for every single policy. And the fact that the general inertia of this narrative are towards costly solutions that permit the government to regulate and control, I no longer think is a coincidence. I do believe it's a convergence of interest rather than a deliberate conspiracy, but the results are the same. When all interests converge, conspiracy is unnecessary. Governments want to regulate, Big Pharma wants to profit. There is no need for centralized authority now that we have the ability to communicate, regulate and govern ourselves using brilliant, amazing, advanced technology such as we're using right now. And in order to counter that, the instantiation of new centralized authority has to be brought about by raising levels of fear and institutionalizing fear. It's something that never goes away.
Reminder that COVID never went away.
Didn't.
We don't know much about Mandy Cohen, the new head of the CDC. Let's see how she arrived in her previous incarnation at the expert decisions to introduce lockdowns, probably on the basis of clinical trials and, as all science must surely be, evidence, empirical evidence.
So I would call, probably the person I called most was the Secretary of Health and Human Services in Massachusetts. She worked for a Republican governor but you know, when she was like, are you going to let them have professional football? And I was like, nope. And she's like, okay, neither are we.
Or you could just chat to your mates on the phone and make those decisions on the fly based on a consensus of government rather than a consensus of science.
So, you know, it was like conversations like that. So, or I'd be like, so when are you going to think about lightening up a mask? They're like, next Monday. I'm like, okay, next Monday.
Follow the science. When did you become a doctor? People that were making those decisions, we've now seen, were just having conversations with their friends or their peers and just forming a consensus in order to give the appearance of a scientific consensus when all that was really achieved was an alliance of friends. When you bear in mind that people that are making those kind of decisions and recommendations in our country, the UK, are now working for, what was it? They're working for that charity where they help children. Sorry, not charity where they help children, Moderna, that make vaccines. It makes you realise that some of these alliances have an economic component and it's not entirely about the service of the public. And indeed, when you watch Mandy Cohen saying that, it doesn't seem like someone that's just trying to do what's best for people. It's someone that's trying to present a unified front for arbitrary authority. After reports of Mandy Cohen's appointment surfaced, posts on social media showed her gloating about implementing COVID lockdowns, inconsistently following her own mitigation guidelines and forcing public schools to have students masked indoors regardless of vaccination status. North Carolina's former health secretary recalled at one point advising Massachusetts Health Secretary Mary Lou Sudders to shutter football stadiums to fall in line with North Carolina's COVID mandates. She was like, are you going to let them have professional football? And I was like, no. And she's like, okay, neither are we, Cohen said with a chuckle. This is like something that happened in Grease the musical or Valley Girls. It's not like two scientists and public officials making a decision for the health of a nation. There's a couple of people giggling their way through a pillow fight. Well, I really fancy Anthony Fauci. Oh, he's such a dreamboat. We oughtn't be surprised that human beings introduce arbitrary guidelines on the basis of alliances with their friends rather than on the basis of empirical scientific evidence. But what we should be is mindful and observant that that's how this authority is achieved. Not by, look, we've looked at this data set versus this data set and we would like to invite you to consider what's best for you. We now know really that when it comes to these pandemics and the regulations, don't assume that they're doing what's best for you just because that's what they're telling you, because now we know that other motivations could include, well, that's what we did because our friends were doing it. Well, that's what we did because I was hoping to get a job at Moderna after the pandemic. There's a whole host of other motivations that are demonstrably true and have to be taken into consideration before blindly obeying authority, I believe. Let me know in the comments what you believe. With all this new COVID around, it makes you wonder if there will be available medicines to mitigate it. There are. What a coincidence. The Biden administration plans to urge all Americans to get a booster shot for the coronavirus this autumn to counter a new wave of infections, a White House official said on Sunday. On Thursday, Moderna said initial data showed its updated COVID-19 vaccine is effective against the Eris and Fornax subvariants in humans. New Lord of the Rings coronavirus with these elves and trolls about us. Moderna and other COVID-19 vaccine makers, Novavax, Pfizer, and German partner BioNTech have created versions of their shots aimed at the XBB.1.5 subvariant. I've heard the names now, Moderna, Pfizer, Novavax, and BioNTech, in so many negative contexts that it's difficult for me to regard them as the harbingers of salvation rather than profiteering organisations funded by you, the taxpayer, that use that revenue to generate huge profits, appoint government officials, have favourable relationships. I don't see those brand names anymore as cause for optimism or inspiration for a new tattoo. Pending approval from health regulators in the United States and Europe, the company's expected the updated shots to be available in the coming weeks for the autumn vaccination season. It's literally spoken about like a fashion now. No, it's vaccination season! Only on NBC, our Thursday night vaccination season special. Which isn't as ridiculous as it sounds, because I feel like there was one bit where the Avengers got vaccines and Sesame Street got vaccines, and And in retrospect, what they should have had is Bert and Ernie having a reasonable conversation about the cost-benefit analysis of lockdowns when it comes to cancer, diabetes, heart disease, mental health, economics, but they didn't cover that, did they? Here's friend of the show, YouTuber Dr. John, talking about Moderna's new boosters.
And the UK government's just struck a 10-year deal partnership with Moderna to build a new factory. Now, this is near Oxford. I believe it's being built at the moment. So the British government is in bed with Moderna to the tune of £1 billion as far as we know.
That's a 10-year programme. 10 years. So you might anticipate that over the next 10 years, the government and Moderna have a literal investment in there being a requirement for Moderna's products. And that $1 billion that the government invested has come from you. Of course, they have to create a favourable cultural environment for those kind of investments. They can't allow us to have free conversations about whether or not you want your money going to Moderna factories. I don't remember being asked. I don't remember voting for it. I remember being told I'm in a democracy. Then I remember learning that Moderna had appointed the government official that was saying I should take Moderna vaccines. And now we're learning that there's a 10-year plan and £1 billion investment that no one asked for and no one voted for.
And this new facility will build mRNA vaccines for COVID, influenza, and respiratory syncytial virus, as far as we know. And the UK government is tied in for 10 years with this group and committed to buy vaccines for 10 years into the future. Quite incredible. We've committed £1 billion to buy these vaccines into the future. Have £1 billion. If it doesn't work out, then we'll still buy the vaccines anyway.
That's an incredible commitment and an incredible deal to have been offered without due scrutiny and with plain evidence that there's a revolving door between the government and Moderna in your country and mine, right up to the Prime Minister of this country being an investor in Moderna who is unwilling to explicitly tell us how much or whether he profited from the Moderna vaccine. It's astonishing.
What is going on here? You know, this is just very, very, very strange. Committed to buy Moderna's vaccines for the next decade from this new factory. Now, if you're sitting in Australia, don't be smug about it, because I think it's just outside Melbourne. I'm pretty sure it's Melbourne. Certainly in Australia, there's a Moderna plant being built to produce I can't remember, 100 million doses of vaccine a year, I think it was.
That's what globalism looks like. Doesn't matter if you're in Australia, the United States of America, or the UK. There are consistent relationships between the state and global corporations that are able to bypass democracy. And the various unelected officials in the various agencies that facilitated those profits continues unabated, unaddressed.
I think the Oxford plant is scheduled to build 250 million doses a year. The Australia plant, 100 million doses.
I assume that means that they're going to quite heavily promote those products, right? Because the government are invested in it. There are all sorts of ways to spend your tax dollars and you're not invited to consider any of them. Just go and build a Moderna factory.
There's also a plant in Canada, a new Moderna plant to construct 100 million doses of Moderna vaccine in Canada. And of course, that's on top of the huge capacity already in the United States. So this is Australia, Canada, the United Kingdom, the United States all seem to be putting a lot of eggs, shall we say, in the Moderna messenger ribonucleic acid vaccine basket. Let's carry on.
Oh, dear old Dr. John there, having an on-camera mental breakdown from the sheer weight of corruption that he is trying to unveil, analyse, and not get banned from YouTube while explaining. Moderna has paid the National Institutes of Health $400 million in licensing fees for a chemical technique developed by federal researchers that was used to create its COVID-19 vaccine. Moderna received nearly $10 billion in taxpayer funding to develop and test the vaccine. Moderna has sold roughly $36 billion worth of coronavirus vaccines worldwide. The company has forecast COVID vaccine sales of $5 billion for 2023. More and more, Julian Assange's maxim, the function of government is to funnel public money into private hands, makes sense. It can also be mapped onto the military-industrial complex war model, the health industry's pandemic model, and perhaps various other seams of what appear to me to be corruption that I've not yet been exposed. The pandemic is back, perhaps because it's necessary for the pandemic to be back, because the pandemic has been invested in. Moderna factories are being built in Canada, Australia, and the UK. Boosters are readily available. Government officials are making their decision on the phone to one another while chatting, and people that work for the government during the pandemic are now working at Moderna and presumably other big pharma companies. But that's just what I think. Why don't you let me know what you think in the comments below? If you enjoyed this video, have a look at either of these. Stay with us, turn on the notification bell and subscribe. And if you want a bit of a relief from the ongoing horror of this world, listen to our fun football podcast, Football is Nice. There's a link in the description for that. More important than any of this stuff is, if you can, please stay free.